Dr. Mama Bear. Let me know if you can hear me okay. Coming to you live on Parasites, Poop, and Practitioners. So, Parasites, Poop, and Practitioners, let me know if you can hear me okay. Yeah, so hot topic right now. Lots of people having issues with parasites. I think number one missed cause of health problems in the United States, if not the world, but definitely in the United States. I can't talk for other countries, but I can tell you, I never thought my first degree is in sports medicine from the University of Florida. What it feels like a million years ago, I worked with a Division I football team during the Coach Steve Spurrier era, and I thought that that's what I'd be doing. I thought I'd be on sidelines my whole life. Then I decided to go to chiropractic school and studied sports chiropractic. Got to work with some cool athletes from Ireland, Scotland, Colombia, Costa Rica, Brazil, South Africa, both soccer players and international rugby players. Got to learn about rugby because I didn't really know about that sport. So that was awesome. Got to travel around the US with them. And then finished out doing working collegiate ice hockey. And then being a Floridian, didn't really know much about ice hockey, so got to learn some really cool sports. And after I graduated from chiropractic school, was the team physician for some local soccer teams, semi-pro men's team, semi-pro women's team, women's professional soccer team, men's professional soccer team, men's professional indoor team. And had a really good time. And what changed all that? It's kind of like I was on this sports performance path, between my undergrad in sports medicine, athletic training, strength and conditioning, to sports chiropractic. I was a board certified sports chiropractor. I had let that certification go just because patients don't care, and I really don't do sideline stuff anymore. And then had my own health journey, right? So the years of early mornings, working 7 days a week, working all weekend, not eating healthy, but then still playing sports, but then working hard in the gym, took its toll. And I actually started losing my hair. I started gaining weight, even though I worked out even harder than when I played professional sports. And what was happening was my health was declining. Through a muscle testing technique based on applied kinesiology. For the first time ever, they told me that I had pituitary problems. So pituitary is the master gland in the brain. And my master gland was had a problem, had a issue. And the issue wasn't like, hey, let's dig your pituitary gland out or put you on pituitary hormones. The solution was to find the cause. And the cause at the time was I had heavy metal toxicity in my pituitary gland, which was causing my hair to fall out, to gain weight, irregular periods, and all that mess. And so that's when I really dove deep into the nutritional world. And as hard as I studied sports chiropractic, I studied holistic nutrition and parasites and chemical detox and metal detox and vaccine detox and Lyme disease and weird bugs and bioweapons and all this mess that you guys know that I do now, and developed the quantum nutrition testing. Hi, Jessica. Hi, Tati. Yeah, so that's the journey. So I never thought, I just finished teaching in the Quantum Nutrition Academy. I never thought that parasites would be my life, right? I thought parasites were, these weird heartworm things that I saw in the jar, that big jar at the vets where they have the dog's heart with the spaghetti looking things. I thought parasites were just something that your dog could get. I didn't think that parasites could be something that humans could suffer from. And there's a lot of humans that suffer from parasites. The Center for Disease Control, even though I don't think they're the greatest organization, they do report that. They say people suffer from this. And it can cause anything from head to toe, from migraines, eye floaters, congestion in the ears, lesions in the lungs, vegetation in the heart, problems in the pancreas leading to diabetes, lesions in the liver, lesions in the spleen, issues in the gallbladder, where some people lose their gallbladder. Isn't it funny we say lose? They didn't lose it. They didn't like, where's my gallbladder? Where did I put that thing? You didn't lose it. The surgeon decided there was a problem there, so they cut it out, right? So I firmly believe a lot of gallbladder issues is parasites, right? Issues in the small intestine, the large intestine, the rectum, prolapse organs, cramps in the legs, cramps in the feet, uh, weird rashes, psoriasis. All these things can be linked to parasites, and they are nasty, nasty creatures. How do you get them? You can breathe them in. So one of my patients grew up in Puerto Rico, and he tells me a story on how his family had this old shed, and they were cleaning out the shed, and it was really dusty, and things were like decomposing, like old paperwork. And he remembers like picking up a box, and all this stuff blew in his face, and he inhaled that stuff. Well, in old decaying matter, what is decaying the matter? It's parasites, right? And so when he inhaled the parasites, you can eat the parasites, right? They could be on rare meat, like raw fish, like in sushi. They can be in your undercooked hamburger or your undercooked steak, undercooked bacon. It's really dangerous, actually. Those of you that are vegetarians, you're not in the clear either. You can have parasites in your banana, in your apple, in your salad greens. You can have them swim in an orifice. An orifice is a hole, right? So they can swim in your ears. They can swim up your nose. They can swim in your other holes, right? They don't even need a hole. They can make a hole and go through the bottom of your feet. You can get them from your dog. Pregnant women are not supposed to scoop cat litter. Why? Because they can get toxoplasmosis, which is a parasite that it lives in poop and cat litter, right? And so you're not supposed to do that when you're pregnant, but how about when you're not pregnant? You can still get that. No one talks about scooping cat litter when you're not pregnant, like whether you're male or female. You can get parasites from cat litter. You can get parasites from your dog, from your cat, from your horse. So they're very, very, very common. And unfortunately, they're hard to find through standard testing. They're hard to find in a fecal test. Why? So here's a piece of poop. Like, just pretend it's not a piece of poop, it's pen, but pretend this is a piece of poop. You submit your fecal sample in a box, right? Or however they're collecting it. And then the technician, the lab tech, is going to scoop a piece of the poop, not to be gross, but just to be real, put it under the microscope on a slide and look for eggs. Well, what if the parasites are all over here? Or what if the parasites are not in this poop? Or what if the parasites are living in your lung? They're not necessarily going to come out in your poop. And so then you might be told, your fecal test might be negative, and they may say, no, I don't know what your holistic doctor is talking about. You don't have parasites. Well, that is if it comes out the digestive tract. What if it's living in your eye as a floater? What if it's living in your lung as a lesion? What if it's living on your heart and causing problems with your heart, like heartworm that dogs get? You're not necessarily going to see them in the poop. Now, if you're doing the full moon protocol, so the full moon protocol is a protocol. It's standard set supplements to help your body rebalance from parasites. So those of you in the full moon protocol group, you can say, hey, we're in the group. Then you can go to bravetv.com and you can order your own parasite protocol. We just had a full moon on Saturday night. It was huge in Boston the night before. On Friday, it was like this big red full moon. I kept trying to get a picture of it, and I couldn't get a good angle. And so you can get your supplements now for the parasite full moon protocol, and you could do that as a group. They'll add you to the Telegram channel, and you can do the protocol. And there's nothing wrong with that. And people have had amazing results doing a parasite protocol on their own with the group support. We've seen we've seen people do the full moon protocol, and they have improvements in their digestion. They have improvements in their energy. They have improvements in rheumatoid arthritis. They have improvements with pain. They have improvements with thinking. They have improvements with so many things, because wherever the parasites are that are getting rid of, that's the area that's going to improve. So it's super, super cool. Then I have some people that need help and they want more of a personalized approach. So that's when I would have you call Palmer Natural Health and ask for a new patient consult. Normally they're $250. Right now we're doing a special. It's only $126. And so we give you paperwork, you fill it out. We want to know about your family history. We want to know about your job. Are you currently a dental hygienist or a dentist and you're exposed to chemicals and metals? Are you a hairstylist and you get exposed to different things in that industry? Are you a mom? Are you a dad? Did you used to work with asbestos? Like what did you do or what do you do? What hobbies do you have? What symptoms do you have? Um, we were talking about earlier, someone was talking about a case, and at 12 years old, this person got migraines and they had this problem, this problem, this problem. So what happened when you were 12 years old? Did you move houses and then the house you moved to when you were 12 had mold in it? Did you have to scoop water out of your basement because there's so much moisture down there? Did you live on a farm and you decided it was a good idea to sit in the chicken coop with the chicken poop and not wear shoes? I've had patients do that. Did you decide that when you washed your horse's butt, you didn't need to wear gloves because why would you do that? Did you go play in the pig pen? Did you have 15 dogs sleep in your bed? What did you do? So we gather all that data, and it's really interesting because sometimes for the very first time, you experience someone who actually cares about what you have to say and actually listens to you and asks you questions. Sometimes we're told that we ask questions that no one ever, out of all the specialists, out of all the doctors, out of all the special clinics you go to, no one's ever asked you that question before. And then we don't just guess what you need. We don't just say, hey, I think this and I think that. We take that data and we do what's called quantum nutrition testing. Quantum nutrition testing is a very specific technology that enables us to find the cause of the problem and enables us to determine if it's possibly due to a consumption of a certain food, like gluten. It enables us to determine if there's some type of immune challenge, like a parasite or a mold or a fungus or a yeast or some kind of old bacteria. And it enables us to determine if possibly chemicals are irritating your system, or heavy metals, or radiation, or old emotional stress, or current emotional stress. These are all things that will cause imbalances in the body. So we look for the cause, we determine the cause. Then we don't just say, hey, just take my favorite thing or whatever I have in stock. We actually do the quantum testing that allows us to check to see what is your exact right thing. Then we determine to see what is the first area to work on, what is the first project to work on, what is the first supplement to rebalance the body. We make sure that you're not sensitive to the supplements. We make sure that that is the best supplement for you. We actually check the dose. We don't just say, hey, the bottle says take 6 of these. We actually check your specific dose, even if it's less than the bottle recommends. And then we put all that data together in a report. If you're a distance patient, we get on the phone with you. If you're local, you can come in and we go over, hey, this is what we found. This is the cause of your problems. And in most cases, it's the very first time someone was actually given a reason for why they feel bad. Maybe it's parasites. Maybe it's chemicals like chlorine or fluoride. Maybe it's heavy metals like mercury or arsenic. Maybe it's radiation poisoning because there's so much radiation in our society right now. Maybe you're just super stressed out, right? There's so many things that it could be. So then we put that all together in a report. We go over it with you. We take time. We answer your questions. We tell you how our program runs. And we let you know what we expect in the program. So we expect 3 things, right? We expect you to make your appointment, which is only 10 minutes. We expect you to write down your food because there's going to be certain foods that are going to help your symptoms. And then there's going to be certain foods that will make you feel like dog poop. And whatever foods that you're eating that make you feel like dog poop, we're going to look for a healthy alternative that still tastes good because I'm a foodie. I'm Italian. I love pizza. I love Italian bread. I was just in Boston and there was an Italian bakery. And yes, I had 2 bites of a cannoli. I ate each end of the cannoli and then I was done. It's not as good as the cannoli I make. And it's definitely not as good as the cannoli I had in Sicily. But it was okay. It's okay. And then I actually ordered an eclair the next day and I didn't even eat it. I looked at it and I'm like, I don't want this. And it was actually the night of the full moon because what you eat during full moons can make you, if you have parasites, make them more active, which means that you can feel anxious, you can feel bloated, you can feel nauseous, you can have diarrhea, you can have vomiting. So some of you have kids that have stomach pains. Those stomach pains may be parasites. Some of you get super bloated and you just blame it on being female, and it's actually parasites. Some of you have irritable bowel syndrome, right? So all of a sudden you have diarrhea and then it changes to constipation, could be parasites. Some of you grind your teeth, you have nightmares, you have psoriasis, rashes, itchy skin, all these things could be parasites. And then some of you are really bad poopers. How often should you poop? You should poop at least once a day. What happens when you poop? Well, the food, goes through your mouth. It starts digestion in the mouth. The enzymes in the mouth start to break it down, especially carbohydrates. You swallow the food, it goes down your esophagus, it goes into your stomach. Your stomach is supposed to have high acid. If you're on prescription drugs like omeprazole lowers the acid. If you lower the stomach acid, you have food rotting in your stomach and you will have digestive issues. So you need to have high stomach acid to digest protein, to break things down. That then goes from the stomach into the small intestines where you're going to absorb all the nutrients from the food. That will then go into the large intestines, and the large intestines will absorb the fluids. It'll absorb the water. It'll absorb, it'll dehydrate what's left over, which is the toxic waste, right? The waste from your cells, the waste from digestion, the waste from everything, the dead parasites. And then you get rid of the waste by pooping it out, right? So you definitely should be pooping at least daily. If those of you that have dogs, how often do your dogs poop? Right? They poop like every single time you feed them. You like feed them in the morning and they go out in the yard and they poop. Or you walk them and you poop, and then you're the human that's bending down and picking up their hot poop. You feed them at night, they poop, right? That's how your digestive system should work. How often should you do the parasite protocol, Natalie? Well, I don't know you. I don't know how many parasites you have. But most adults have been accumulating parasites their whole entire life. And unfortunately, your mama could give you parasites too. And I don't see that, and I don't say that in a mean way. But when you think about the animal world, what do they do to puppies? What do they do? What do veterinarians do with kittens? What do they do with brand new horses, right? They deworm the animal. How come we don't get dewormed? Now, in other countries, they do. So I've had people from Korea, Jamaica, the Bahamas, other parts of the Caribbean, other Latin American countries tell me that as a family, they do a parasite cleanse. So my Jamaican patient is the most hilarious. She's like, Dr. Palma, and I can't do a good Jamaican accent. I try, but it comes out sounding really wrong. So just pretend I'm talking with a Jamaican accent. And she goes, we do a family blowout. And so once or twice a year, the family takes certain herbs and they all spend time in the potty. You would think that they would do it like separately, just so what if you only have one bathroom? Or what if you only have a couple bathrooms and everybody has to poop at the same time, right? But the family does it together. The doc I met this weekend from Korea, he said in elementary school, they would have you bring in a fecal sample, have you bring in a poop in a box. And the school would run testing, or a lab would run testing to see which students had parasites, and they put them on parasitic medications, the students, right? And that was a third world country. Well, newsflash, guys, we have parasites in the US as well. And it is so overlooked in so many cases, and so many people are suffering. So many people are suffering that we're training other practitioners on how to handle this properly. There's only so many people that we can see. And the people we see, if you're one of the people we see, we love you, right? And we want to help your friends and we want to help your family. But there's only 7 of us right now. Yeah, 7 of us, 7 practitioners. And so if you need help, we're happy to help you. Aaron says, my high acid is causing my esophagus to swell and having swallowing issues. Yeah. Sorry, I ate spicy food before I came in and my nose is trying to run. And I realized that was probably not a good thing to eat before I'm talking. So if you have high acid, yes, so here's a problem with acid reflux, right? Is you have your esophagus and then your esophagus leads into your stomach. There's a valve there. That valve can get irritated by a cause. It could be a parasite, it could be a chemical, it could be a metal. And if that valve doesn't close, the acid is going to leave the stomach and come up into your esophagus. it can actually wear a hole in the esophagus called an ulcer. It can wear holes in the stomach called ulcers. But you should not have that happening, right? If you have high acid, or if you have acid coming from your stomach into your esophagus, there's a cause to that. So you can lower the acid. That's one solution, but it doesn't fix the cause. So I am not saying if you're on prescription drug, I am not telling you to stop. But I am asking you to think what could be the cause. So in my experience, in almost 20 years of practice, it's a chemical, it's a metal, it's a parasite. Something is causing that. Okay, good. All right, so then practitioners. So was able to be in Boston for the Cell Core seminar. It was awesome. Dr. Darren Schmidt and Jimmy Scringy were presenting. Myself and Dr. Dean were helping with some of the students, and we had over 100 practitioners, medical doctors, doctors of osteopaths, pharmacists. There's a couple pharmacists there. I was like, oh my goodness. One of the pharmacists I was talking to was like, yeah, I know what we're doing when people's not working. I know we're just chasing their symptoms. I know that this more medication is not the answer. And in fact, he was telling me when he was in pharmacy school, he said he was in his last year and he was depressed. He's like, we don't fix stuff with drugs, we just cover symptoms. And he had a hard time. I appreciate him because he admits that that system's broken. He admits that what they're doing is not working. He admits that there has to be a better way. He was telling me that his grandpa was an acupuncturist. And his grandpa used herbs and Chinese medicine to balance out the body. And so I think that's what that led him into pharmacy. But unfortunately, a synthetic chemical will never replace the function of a plant, right? If you take, so the problem with this is a lot of pharmaceutical drugs, if not all of them, have patents, right? And so you can charge a lot of money if something is patent protected. And when you can't patent protect a plant. So in Chinese medicine and a lot of things that we do, we use herbs. You can't patent a plant. Now, if you genetically modify the plant, you can, right? But you can't patent a plant. Plants are natural. Plants are here. It's a God-given present. Is the weeds in the on the earth heal, right? What we consider weeds, and it's crazy because some of these weeds, like dandelion's great for the liver, and so people spray the dandelion with things like glyphosate, Roundup, and Roundup is cancer causing. So isn't it ironic? The dandelion's there, will clean out your liver. It's very bitter. It can clean out the liver. And that yet people are taught in our society to spray those weeds with a cancer causing chemical. You don't believe me? Monsanto was sued for billions of dollars due to the connection between Roundup and non-Hodgkin's lymphoma. And that's just one type of cancer, right? And so my question is, why is Roundup still on the shelves? Why is it still being sold? How come your neighbor next door could spray it? My neighbor next door has a lawn company, and they park in front of our house and go spray their house. And I hate that. Hate it, right? Because it gets in the air, it gets in the water supply. It's awful. But I understand farmers, I have some cool patients that are farmers, and they have machines that are for Roundup ready crops. And those machines they're teaching me, those machines are millions of dollars. They're really expensive. And then when they plant GMO crops, when they plant Roundup ready crops, they can't just switch over to organic because it takes, I think, 7 years to convert soil from filled with chemicals to organic. And does it really get all the chemicals out? I don't think so. Because remember, organic doesn't mean no chemicals. It just means less chemicals. So we live in this crazy, crazy planet with lots of parasites, with a broken medical system, with some of you guys suffering with symptoms. I hear all the time, oh, it's my normal headache, or it's my normal migraine, or it's my normal period cramps. Yeah. No, those are not. If you have a symptom, it is not normal. There's a different definition between normal and common. And for some reason in our language, people they're using that word for both meanings. Oh, it's my normal headache. Headaches are not normal. An ache in your head is not normal. It's common. A lot of people suffer from headaches, but it's not normal premenstrual syndrome. So a lot of women say, oh, yeah, PMS, blah, blah, blah. It's my normal PMS, or this is my PMS. Like they talk about it. It's like everybody has it. PMS is common, but it is not normal. You should not have PMS. You should just, when you have menstruation, when you have menses, it's just the shedding of the uterine wall. It doesn't mean cramping. It doesn't mean be emotional. It doesn't mean turn into a whatever. It doesn't mean tender boobs. It doesn't mean cramps. It doesn't mean any of that. It just means the uterine wall is removed, is shed, is broken down. And so then the body can put a new uterine wall in the future of possibly having a baby, right? But it doesn't mean all those symptoms. So I encourage you, if you are having symptoms, please let us help you. Please let us figure out why you're having these symptoms. What's going on with the symptoms, right? So a couple questions. So Tiffany says, I'm on a personalized program with Palm Natural Health. Part of my program is detox supplements. I've been purging parasites on and off since January, February of this year. I've been purging them a couple times a week for past 2 months. Yes, I've had extra binders and Para3 added to my program. Yeah. So the parasite protocol on Brave TV is a good place to start. Like if you're like, I don't know what to do. I don't know your health history. So I'm not advising you as a doctor. I'm just saying, hey, read about it, go to that page, read about it. If it indicates to you, if you're like, yeah, that makes a lot of sense, then do it, right? I don't know your health history. I don't know your background. So I'm not advising you personally. I'm just saying, read it. If you like it, do it. It is not a guided protocol. If you want more help, if you want a personalized program, if you want someone holding your hand, if you want someone making sure you're moving in the right direction, then call Palm Natural Health and we can help you. Jessica loves Para3. Yes, I agree. Are you talking to me right now? Hi, Alex. I'm talking to all y'all, but if it indicates, then ask us for help. Okay, cool. Yes, you have to come over and see us, or you can do telehealth. So we have patients from all of the United States, U.S. territories like Guam and Puerto Rico. We have patients in Anchorage, Alaska, and Fairbanks, Alaska, in Denmark, Australia, Italy, Spain, Ireland. Trying to think of who else is, I think I said all our European countries and far countries. Yeah, basically everywhere. And so we kind of were joking pre-pandemic. We were joking, we're going to help people in Florida and in the United States. And then we went, we're going to help people in the United States and the world, right? And then we started doing that. And then we were joking, we're going to help people on Earth and other planets. And I'm like, oh wait, I don't know anatomy of aliens, right? I was watching an old Star Trek episode, and they had like different aliens from different planets, and they made them look like whatever you think an alien should look like. And I'm like, I don't know their anatomy. I guess I can quantum test. And then they're, some of them could be telepathic, but that's getting a little deep. So Serbia, we don't have any patients in Serbia yet. Oh, Croatia, but not Serbia. Colorado, yep. So Natalie's in Virginia, cool. But yeah, so we'd love to help you. So the first step is to call the office. They're going to ask you for the consult fee, which is not $250 right now. It's only $126, which is a steal because it's really, you pay once and you get 2 appointments out of it. We'll do the consult for a half hour. If you're out of town, on the phone. If you're in town, come to the office. If you want to come from out of town to the office, you're welcome to do that too. And we ask you all the questions. We dig deep. We see what's happening with you. We take that data. We do the quantum nutrition testing to find the cause. Once we've identified the cause, we put it all together in a program for you. Make sure it's specific to you based on what your body needs to heal. We present that program to you in a report that we send to you, that you get emailed to you, or if you're in the office, we hand your report to you. And we go through everything, and you ask us all the questions. We tell you the causes. We tell you the supplements that balance out the body. We tell you how the program works. And then you tell us, yeah, let's do this, or nah, I don't want to do it. And whatever you decide is totally fine. Most people are really excited that they finally have a cause for the first time in their life. They finally have been validated and acknowledged. that there is a cause to their migraines, and that there is a cause to their diarrhea, and there is a cause to their horrible periods, and there is a cause to their explosive diarrhea or their nausea or their vomiting or their stomach pains or their rashes or their whatever, right? And then we hold your hand through the process. We don't just say, take these and see you in 3 months. We hold your hand, we answer your questions, we educate you on all of these things. We figure out the foods that work well for you that you like to eat. And we're not going to make you eat stuff you hate to eat. We look at the foods that you're already doing that's a good job, and we acknowledge that. We educate you on all the different natural healthcare things like parasites and toxins and chemicals and lifestyle and stress and all that. We retest you midway in the program. We retest you at the end of the program. The program's 3 months. And then we generate a new report. And the purpose of the report is to compare where you started, your migraines, your PMS, your bloating, your diarrhea, your not sleeping, whatever it is, and then where you are now. And out of all the cases I've ever worked on, as long as someone does the program, and by the program, I mean those three things: make the appointments, 10 minutes on the phone, take your supplements, write down your food, and make changes. And not overhaul everything. Unless you're dying, then we make you overhaul everything. And we don't really like dying cases, they're not that much fun. We want to get you way, way before that. So please, if you're doing bad, please don't wait till you're really, really bad, because then it costs more money, it takes more time, and we may not accept your case because dying patients are not fun. And I don't mean that in a disrespectful way or a mean way or an insensitive way. I just mean, hey, we have a lot of work to do on this planet. And so I prefer to get mom who can then educate the dad, who then can help the kids, that then can help the future generations, and so on. So DL Johnson says 3 of us in Washington. Awesome. Natalie says awesome. Jessica says so worth it. So that's what I wanted to tell you tonight. I wanted to tell you, hey, parasites are a real thing. They do exist. It is not mucoid plaque. You could get rid of mucus in the intestines too, but they exist. They exist in animals. They exist in us. And you got to poop every day. You got to poop every day. If you're not pooping every day, you're toxic. That toxicity is going to come out in your skin. It's going to come out in your breath. It's going to come out in your armpits. You're going to be stinky. You're going to have imbalanced hormones because your body's going to reabsorb the toxins. You're going to have issues. You're going to have issues with your colon. We got to fix that. There's solutions. And then practitioners. So I'm one of 7 practitioners in our office, and our practitioners are awesome. I get to hear their clinical cases on Wednesdays, and we have what's called, I love Wednesdays, it's called the practitioner panel, or excuse me, it's called the practitioner meeting. On Monday, we did the practitioner panel. You can go back and watch that. And we got to talk about cool cases and how people are improving and how people's symptoms are going away, and the little babies with the head to toe rash that are now doing better. Grandma who was exhausted is now dancing again. Moms that were mean and had no energy and kind of screamed at their kids are nice moms again. Teachers that were exhausted and had nothing left to give now can live their full purpose. So really, really, really cool. Jessica says she keeps a poop and supplement journal for my kids so she can keep straight. That's good. That's awesome. Yeah. So you want to know, is your kid going to the bathroom? If you have an infant, how many pee diapers, how many poo diapers, right? So you guys can ask me questions. I'll stay on for a little bit. You can ask me about parasites. You can ask me about poop. You can ask me about weird conditions. You can ask me for a friend. Ask me what you want. And I'll see what I can do to answer. It is amazing to me. One thing I really appreciate about myself and my husband and the rest of my associate practitioners is we never stop learning, right? So we went to the basic seminar, and I'm thinking, it's a basic seminar. What am I going to learn? Because I'm not a basic practitioner. And I was assisting, and in assisting, I learned, because each class is different. Each class has different students attending, different questions, and it's awesome. So never, ever, ever stop learning. If you go backwards in time on my Facebook feed, for my personal page, if you're streaming with me on the Palmer Natural Health page, go backwards in time and look at all of the Facebook lives that we've delivered. Why do we do that so much? Because it is crucial that you guys understand that things have causes and there's natural solutions. We go live for Palmer Natural Health every single week. When I was super sick, so I told you guys about when I had mercury poisoning in my pituitary gland, there was a time I was really, really dizzy, and I actually thought I wasn't going to make it. And I said a prayer, and I said, God, I'm a professional athlete. You can't have me here in bed for the rest of my life. I don't want to live that kind of life. That's just sounds miserable to me. And the message that I got back, and whatever your religion and whatever your spiritual belief, it's totally cool. And the message I got back was you got to tell your patients the truth about natural health care. And it wasn't that I was lying to my patients. That sounds pretty horrible. But as a sports chiropractor, I really, felt bothered. And again, this sounds horrible, but it's true. I was bothered by the diabetic patient or the obese patient or the high blood pressure patient. I was working with professional athletes that were very fit. Were they healthy? No, there's a difference between being fit and healthy. So my old definition of health was somebody who had good muscle tone, who you could see on the cover of a fitness magazine and they look good, right? I think that's how most people define health. That is not the definition of health. The definition of health is 100% of your organs and glands. So I hate to tell you, if you're missing your gallbladder or your appendix or your tonsils or your ovaries, you cannot ever, ever, ever be 100% healthy because you are not 100% you anymore. It doesn't mean there's no hope for you. It just means you're missing parts, right? In the academy, we were just talking about one of the practitioners was working on a case. The lady had no tonsils, no ovaries, no uterus, no appendix. Something else was no gallbladder. And I'm like, oh my gosh, she is missing so many parts. All those parts have a function, right? So the definition of health is 100% of the organs and glands in your body and your systems in your body working at 100%, right? They're 100% healthy. And that's the definition of health. It's not what you look like on the outside. Now, yeah, healthy people will have a certain look, and sick people definitely have a look. One of the practitioners that was attending this class in Boston, she didn't look good. She was like extra skinny, like skeleton kind skinny, and her skin tone was yellow. No, that's not what you're supposed to look like, right? Those are signs that something's wrong. And so, yeah, so never stop learning. So these practitioners, myself and Dr. Dean, we kept learning. We learned new stuff. The 100 plus practitioners in the room with us were learning. Even Jimmy and Darren as instructors, I'm sure they're learning. Never stop learning, right? Okay. So Gina wants to know something about the Cell Core event. Oh my gosh, Gina. You want to see the books? Gina wants to see the books. So we have I appreciate them. It's just like we do in Quantum Nutrition Academy. I'm always upgrading stuff. So I'll show you the toys I got, Gina. You ready? Oh, this is gross, Gina. Oh, it's so funny. I left it on this page and it's actually perfect. So here's a little one of the booklets we got. We got a booklet for the both days. And they just did a really nice job with this. I really like how they did it because the big binders are really hard to travel with. These little books are so convenient. So anyway, so this is a gross, disgusting. I don't know if you guys can see that. That's a parasite coming out of somebody's nose. It's the length of their middle finger. Blah, so disgusting. And then we were learning about all the different types of tapeworms. So like most people think tapeworm, right? So there's a fish tapeworm, tapeworm called flea tapeworm, cucumber tapeworm. That makes me think. So farmers or gardeners, cucumber tapeworm, doesn't that make you think that they grow in cucumbers? I have to research that. Double pored tapeworm, hyper tapeworm, dog tapeworm. So my Labrador, I got tapeworms out of him. Rat tapeworm, where do you think that thing lives? On rats or in rats? Dwarf tapeworm, beef tapeworm, pork tapeworm, right? So that's just talking about tapeworms. And then if you want to talk about flukes, what the fluke? The Chinese liver fluke, guess where that lives? The giant intestinal fluke, the common liver fluke or the sheep liver fluke, the large liver flukes. No wonder why people have gallbladder issues, right? The von Siebold fluke, the Japanese lung fluke, the Oriental lung fluke. So Japanese is the same name. And I'm not quite sure how you say this one. That sounds like a bad word. The schistosomias. Wow, I'm going to try to type that because that is quite the word. So those of you that can see this, it is insane. I don't know why this thing is in my way, so I'll do my best. So it's S, come on, SCHISTOSOMIASIS. That is, you guys should research that. That is quite the spelling word there. That's a spelling bee word. Also known as blood flukes. So guess where they live? In the blood, right? So what is the function of the appendix? The function of the appendix has immune system function. But unfortunately, you'll find someone who's like eating popcorn or seeds. Since it's coming off the end of the colon, it can get inflamed. And when it gets inflamed, it may even have parasites in it. And so an inflamed colon or inflamed appendix does not feel good. And you can have an itis of the appendix. So appendicitis, itis is inflammation of the appendix, can cause pain. If it causes too much pain and it gets too infected, it'll rupture, and that is a bad thing that can kill you. So the appendix has immune system function. Why do they go bad? Usually the sequence of events is someone eats a lot of roughage like popcorn or salad or nuts more than what they normally consume, and they already have a parasitic problem. That appendix gets backed up, gets infected, it gets enlarged, and then sometimes it ruptures. So it can be pretty nasty stuff. All right. I've learned a lot about that particular parasite lately. Cool. Awesome. All right, guys. Well, hopefully that helps you. Tonight's topic's been parasites, poop, and practitioners. I am Dr. Lisa Palmer, also known as Dr. Mama Bear. If I can help you in any way with any symptom, I would love to find your cause. You can call our office and we can find the cause of your problem and give you the help that you need. Wish you a happy, sweet dreams, restful night. Good night, everyone. Bye.